philosophy thing, that, but it also translates into cost benefit. If you're not, pouring bucketfuls of FSH in every day, then the cost, you can make cost savings for the patient there, really, in terms of having simpler forms of IVF where you use less hormonal stimulation, and that translates into cost savings as well. So, that's a slightly different philosophy. I mean, I wouldn't argue whether it's right or wrong. It's different. I've certainly worked in places where the philosophy is different, but I think this is certainly safer, certainly much safer. Ladies, also, you have to be clear to them that at the outset, you're not aiming to get 15 to 20 eggs. We're just really not. We're aiming to get between 5 and 10. And if you get between 5 and 10, you're unlikely to be unwell yourself, extremely unlikely to need hospitalization. And, actually, in terms of pregnancy outcome, you're likely to do just as well. So it's about balancing that safety side of things, which I think sometimes gets lost in the way that, IVF is, just dealt with as a sort of, protocol driven type of treatment. And let's just, okay, it didn't do that well, let's just give you, twice as much FSH next time and see whether you do a bit better, and you go from 3 eggs to 4 eggs, and you've gone up to 600 units of FSH. So the philosophy there is very clear across the company that treat ladies appropriately. There are some ladies who, you might use 225 or something like that, but there are a lot of ladies who are down at 100. So the sort of the curve of doses is shifted very much towards the left. And I think, as I say, the biggest difference there is the safety profile of the treatment you're doing. And you ended up doing that, but explain to the patients, look, we might push you up from 300 to 450, but actually that may mean we get 1 more egg, and really that's difficult to justify if you're paying, pro rata for the FSH, because you're going to push your costings up a lot. And really, are you doing that for any real clinical benefit? I think it's doubtful that you are.